Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about breast cancer. In particular, I will cover what is breast cancer, how you treat breast cancer, and how you can live better with breast cancer. So to start, what is breast cancer? Cancer is a group of abnormal cells that grow more rapidly than normal cells and that refuse to die. Cancer cells also have the ability to invade and destroy normal tissues, either by growing directly into surrounding structures or after travelling to another part of your body through your bloodstream. Breast cancer is cancer that forms in the cells of the breasts. It accounts for 28% of all cancers in women in Ireland, with an average of about 2,000 new diagnoses made each year. There are several different types of breast cancer, which can develop in different parts of the breast. The most common is known as ductal breast cancer, which develops in the cells that line the breast ducts. Ductal breast cancer accounts for about 80% of all cases of breast cancer. 1 in 9 women are affected by breast cancer during their lifetime. There is a good chance of recovery if the condition is detected in its early stages. For these reasons, it is vital that women check their breasts regularly for anything unusual and always get any changes examined by their GP. So what are the signs and symptoms? So number 1, a lump or thickening area of tissue in either breast, discharge from either of the nipples, which may be streaked with blood, a lump or swelling in either of your armpits, a change in size or shape of one or both of your breasts, dimpling in the skin of your breasts, a rash on or around your nipple, a change in the appearance of the nipple, such as becoming sunken into the breast, or pain in either of the breasts or armpits which is not related to your period. If you have a lump in your breast, it is important to remember that it may not be the result of breast cancer. In fact, 90% of breast lumps are benign, which are non-cancerous. For example, a breast lump may be caused by a harmless cyst, which is a small fluid-filled lump, or fibroedema, which is a benign growth that are quite common. You may also find that your breasts feel lumpy just before your period. So how is breast cancer diagnosed? A blood test can be carried out, or a sample of your blood will be taken so that your doctor can access or assess your overall health, as well as know how your liver and kidneys are working. A mammogram can be carried out, and a mammogram is a simple procedure which uses X-rays to create an image of the inside of your breast. A breast ultrasound can be carried out, and you may need to have a breast ultrasound if you are under the age of 35 because the breast may be too dense for a mammogram. And next, a biopsy is an option. A biopsy involves taking a sample of tissue cells from the breast and testing them to see if they are cancerous. To see if the cancer is spread, you may need the following tests: a CT scan or MRI scan, chest X-ray and bone scan. So next is, how do you treat breast cancer? Treatment for breast cancer is usually carried out using a combination of surgery, chemotherapy, radiotherapy, and in some cases hormone or biological therapies. The amount and type of treatment that you receive will depend on the type of breast cancer that you have, as well as its stage and grade, and your overall health. So for breast cancer surgery, operations used to treat breast cancer include removing the breast cancer, which is a lumpectomy, removing the entire breast, which is a mastectomy, and removing one lymph node, sentinel node biopsy, or removing several lymph nodes, which is axillary lymph node dissection. And next, for chemotherapy can be used. Chemotherapy uses drugs to destroy cancer cells. Also, an option is radiation therapy. So radiation therapy uses high-powered beams of energy, such as X-rays, to kill cancer cells. Next would be hormone therapy. So hormone therapy, perhaps more properly termed hormone blocking therapy, is often used to treat breast cancers that are sensitive to hormones. So next, the treatment options is using targeted drugs. Targeted drug treatments attack specific abnormalities within cancer cells. So Herceptin targets a protein called HER2 that helps some breast cancer cells grow and survive. If your breast cancer cells make too much HER2, Herceptin may help block that protein and cause the cancer cells to die. And finally, we look at how do you better live with a breast cancer diagnosis. So a breast cancer diagnosis can be overwhelming, and just when you're trying to cope with the shock and the fears about your future, you're asked to make an important decision about your treatment. Every woman finds her own way of coping with breast cancer diagnosis until you find what works for you. It might help to learn what you need to know about your breast cancer, talk with other breast cancer survivors, find someone to talk about your feelings with, and keep your friends and family close, and take care of yourself. Finally, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas to assist with managing a breast cancer diagnosis more effectively. So pharmacy products, to start with, we have numerous products available to get you started on a very gentle exercise regime. Doing gentle exercise is very beneficial and should be part of any management strategy. But first, get the okay from your doctor. So to get you started, we have exercise balls, floor mats, weights, and various equipment required for weight-bearing exercise. Get advice from your doctor if you want to take supplements and are having any kind of cancer treatment. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new service, a telehealth clinic. You can book a 30-minute clinic at our pharmacy in order to increase your understanding of your illness. During this clinic, we create a cohesive management plan which enables you to take a more active role in managing breast cancer diagnosis with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.